Good evening. Welcome to Tongue Matters, Tongue Diagnosis Made Easy. We shall cover introduction, tongue body color, tongue body shape, tongue coating, and tongue images and patterns. Introduction. We shall discuss general principles, conditions for examining the tongue, areas of the tongue, and clinical significance of the tongue. Tongue diagnosis is a very important part of diagnosis by observation. The strength of tongue diagnosis lies in its clarity and objectivity. Especially when compared with pulse diagnosis, tongue diagnosis is quite objective. When the tongue is too red or too pale, this can be observed objectively. Another important strength of tongue diagnosis is its capacity to shed light on complicated conditions. For example, a simultaneous deficiency of kidney yin and kidney yang is quite common in women over 40 and especially in menopausal women. This simultaneous deficiency can give rise to confusing hot and cold manifestations. The tongue will indicate quite clearly whether there is a predominance of kidney yang or kidney yin deficiency. The tongue reflects the state of the internal organs and that of qi and blood. From the eight principal point of view, it clearly reflects heat cold, full empty, and yin yang conditions. Proper lighting is absolutely essential for a correct examination of the tongue, and the only good lighting is natural light on a sunny day. The room where the patient is examined should have an abundant source of natural light. For example, no proper natural light can ever be achieved in a basement. Even in daylight, the color of the tongue can be interpreted properly indoors, only if the day is sunny. On a cloudy day, the color of the tongue cannot be accurately observed indoors. If the patient is examined on such a day, it is advisable when observing the tongue to ask the patient to stand next to a window or even outdoors. Obviously, it is seldom possible to achieve ideal conditions. If it is necessary to observe the tongue on a cloudy day or in the afternoon or evening, the best artificial light is that of a halogen bulb. And the best way to observe the tongue is by means of a table lamp fitted with one of these bulbs. One should not ask the patient to hold the tongue out for longer than approximately 15 seconds because the longer the tongue is extended, the darker it will tend to become. If we need longer than 15 seconds to observe the tongue, which we normally do, we should ask the patient to withdraw the tongue, close the mouth, and extend the tongue again. This can be done several times without affecting its body color. It is very important to examine the tongue systematically, following always the same order, which should be as follows: tongue body color, tongue body shape, coating, tongue spirit. Following this systematic order of observation of the tongue is strongly recommended because the above order reflects the relative clinical importance of each item. For example, the tongue body color reflects conditions of heat or cold and deficiency of yin or yang in various organs, and especially the yin organs. It should therefore be always the first aspect to be observed. The tongue body shape often simply adds information to that gleaned from observation of the tongue body color. For example, if the tongue is pale from yang deficiency, its swelling will simply indicate that the yang deficiency is particularly pronounced. The tongue coating reflects more the condition of the yang organs, and it is easily influenced by short-term factors, which makes it relatively less important than observation of the tongue body color in chronic conditions. The most obvious external factors affecting the color of the tongue are highly colored foods, sweets, drinks, or pastilles. If a patient's tongue has a very obvious, unusual bright color, always ask what he or she has been eating. Spicy foods such as cayenne pepper and curry may tend to make the tongue slightly redder soon after consumption. Tobacco smoking usually colors the coating yellow, and in regular smokers, this is permanent. However, this cannot be written off as no more than a false appearance due to an external factor. In fact, tobacco, which has a hot energy, will tend to create heat. Some medicines affect the appearance of the tongue, and the most common ones are antibiotics. These tend to make the tongue partially peeled, that is, the loss of small patches of coating. Therefore, when you see such a tongue, the first thing you ask is whether the patient is on antibiotics or has taken them recently. The effect of the antibiotics on the tongue lasts for about 2 weeks after stopping the course. Judging from the effects of antibiotics on the tongue, we can deduce that they injure stomach yin. Oral corticosteroids tend to make the tongue red and swollen. Inhaled bronchodilators, such as salbutamol, may cause the tip of the tongue to become red, but only after many years of use. Anti-inflammatory drugs such as phenylbutazone paradoxically cause the tongue to develop red points. Most cytotoxic drugs used for cancer tend to create a very thick, dark yellow or brown coating and also to make the tongue body red. In men and women alike, the tongue body can be divided into 3 areas. The rear corresponding to the lower burner, the middle to the middle burner, and the front to the upper burner. Therefore, according to this division, the front third of the tongue reflects the state of the heart and lungs, the middle third that of the stomach, spleen, liver, and gallbladder, and the rear third that of the kidneys, bladder, and intestines. The relative position of the heart and lung areas on the tongue should be explained in relation to redness, swelling, cracks, or purple color. When there is lung heat, this will make the whole front of the tongue red, including the heart area, even though the heat is only in the lungs and not in the heart. When there is heart heat, only the tip of the tongue becomes red. As far as swelling is concerned, a swelling of the tip itself indicates a heart pathology, usually heart heat. A lung-related swelling usually appears either in the whole front third or on the sides between the heart area and the stomach and spleen area. As far as cracks are concerned, lung cracks are usually located in the area between the tip and the center. A purple color on the sides of the tongue, between the tip and center, may be related to the lungs or heart. It indicates blood stasis, and in lung disease, it is seen in chronic asthma or emphysema, while in heart disease, it is seen in coronary heart disease or angina. The purple patch may be unilateral or bilateral. In women, in addition, a purple color in that area may also indicate a breast pathology. Although the sides of the tongue correspond to liver and gallbladder, they may also, under certain circumstances, reflect conditions of the spleen. A pathology of the liver, such as heat, is reflected along the whole side of the tongue, while one of the spleen is also reflected on the sides, but only in the central section. This applies to both redness and swelling. The clinical significance of the tongue must be related to its various aspects as follows. The tongue body color reflects primarily the state of the yin organs and blood, and it shows conditions of heat or cold and of yin or yang deficiency. The tongue body's own color is visible through the tongue coating, and it is important not to confuse the two. Generally speaking, the tongue coating does not extend right to the edge of the tongue, and therefore, the sides of the tongue can show us the tongue body color if the coating is very thick. Examination of the body color should also always include an examination of the veins under the tongue. The normal stomach fluids tend to make the tongue pale, whereas heart blood tends to redden it. The influence of these two organs, therefore, causes the normal tongue to be pale red, indicating a good state of stomach fluids and heart blood. The tongue body shape reflects primarily conditions of deficiency or excess, and observation of it adds more information to that gleaned from the tongue body color. Observation of the tongue body shape includes consideration of the shape itself, its thickness, thin or swollen, its suppleness, stiff or flabby, its surface, cracks, and its involuntary movements, quivering, moving. The normal tongue body shape is supple, not swollen, not thin, and without cracks. The tongue coating reflects primarily the state of the young organs and especially of the stomach. It also reflects conditions of deficiency or excess and of heat or cold. The tongue coating is formed when some of the fluids generated in the process of the stomach's digestion of food flow up and create its coating. A thin white tongue coating, therefore, indicates a good state of stomach qi, while a rootless or an absent tongue coating indicates weakening of stomach qi. The tongue coating should be thin enough for the tongue body color to be seen through it. The tongue spirit refers to the general appearance of the tongue. This is called shen in Chinese, and it is much the same as the shen of the complexion and eyes, referring to the qualities of brightness, sheen, and vitality. One can therefore distinguish two types of tongue, one with spirit, the other without spirit. A tongue with spirit denotes certain qualities of liveliness, suppleness, vitality, and brightness of the tongue body. A tongue without spirit looks lifeless, rather stiff, rather dark, and dull. A tongue without spirit denotes a poor prognosis, or that the condition is more difficult to treat. We have reached the end of the topic on introduction, and we should have understood the best light for accurate tongue diagnosis, the recommended systematic approach to tongue, observation of the body color, body shape, coating, tongue spirit, the external factors that may influence tongue color, the different tongue areas and their clinical significance, and the clinical significance of body, color, shape, coating, and tongue spirit. For tongue body color, we shall take up tongue spirit, tongue body color, and sublingual veins. A tongue with spirit denotes certain qualities of liveliness, suppleness, vitality, and brightness of the tongue body. A tongue without spirit looks lifeless, rather stiff, rather dark, and dull. One can use the analogy of a piece of meat in a butcher shop. The tongue with spirit looks like a fresh piece of meat, while the tongue without spirit looks like an old piece of meat which has become dark, grayish, and lifeless. The spirit should be observed in particular on the root of the tongue because the root reflects the state of the kidneys, and the spirit of this area reflects the condition of the kidney essence. The kidney essence is the foundation of life, and the absence of spirit on the root of the tongue indicates a severe deficiency of the kidneys and therefore the tendency to ill health. The tongue spirit is basically a prognostic sign, as a tongue with spirit indicates that the patient may recover relatively easily, whereas a tongue without spirit indicates that whatever the patient may suffer from, the treatment may be prolonged. It is important to remember that the tongue spirit has nothing to do with other pathological signs on the tongue. In other words, the patient may have a tongue that is pathological in many respects. For example, red with a thick coating, But if it has spirit, this indicates that the kidney essence is still strong and that the body can fight off pathogenic factors. The tongue body color reflects primarily the state of the yin organs and blood, and it shows conditions of heat or cold and of yin or yang deficiency. The normal body color is pale red. Traditionally, 5 pathological colors are described, that is, pale, red, dark red, purple, and blue. However, the clinical significance of the dark red tongue is essentially the same as that of the red tongue, and the clinical significance of the blue tongue is essentially the same as that of the bluish purple tongue. Therefore, the pathological colors may be narrowed down to 3: pale, red, and purple. The pale tongue indicates either yang deficiency or blood deficiency. In yang deficiency, it will tend to be slightly wet, whereas in blood deficiency, it will tend to be slightly dry. The latter is much more common in women. If it is only slightly pale, this may also indicate Qi deficiency. The tongue is often pale only on the sides. If the pallor is all along the sides, this indicates liver blood deficiency. If it is only in the central section, it indicates spleen blood deficiency. In severe cases of liver blood deficiency, the sides may also become orangey. The pale tongue normally has a coating, and the pale tongue without coating indicates severe blood deficiency. This is relatively rare and it is usually seen only in women. The red tongue is redder than the normal color. Although traditionally 2 shades are described, that is red or dark red, the clinical significance of these 2 is essentially the same. A red tongue always indicates heat, which may be full or empty. Therefore, when we observe a red tongue, the first thing we should ask ourselves is whether it has a coating or not. If the tongue is red with a coating with root, whatever its color, this indicates full heat. If the tongue is red without a coating or coated only partially or with a rootless coating, whatever its color, it indicates empty heat. It should be stressed that a red tongue without coating indicates specifically empty heat rather than yin deficiency, although obviously it arises from the latter. In other words, it is the lack of coating that indicates the yin deficiency, and the redness without coating that indicates empty heat. The implication of this is, of course, that there are many tongue types that indicate yin deficiency, while the tongue body is not red. The tongue body may be red in specific areas, especially the tip, the front third, the center, or the sides. A red tip of the tongue indicates heart heat, full or empty. If the tip only is red, this indicates that the condition of heart heat is slight. Whereas if the whole tongue is red and the tip redder, it indicates that there is generalized heat and severe heart heat. Red sides all along the edge indicate liver heat, while a redness on the sides only in the central section indicates either stomach heat or spleen heat. If the tongue is red in the center, it indicates stomach heat. If it is red in the front third, including the tip, it indicates lung heat. Ancient Chinese books on tongue diagnosis say that the physiological minister fire, ascending to communicate with the heart, forms red grains on the surface of the tongue, bearing in mind that the tongue is the offshoot of the heart. These red grains are normal and indicate that the physiological minister fire is in a healthy state. That is, it is neither excessive nor deficient. When the minister fire becomes pathological from various life influences, it flares upwards, causing the red grains to become redder and to protrude from the surface of the tongue so that they become more visible. When this happens, they are called red points. Therefore, red points are always pathological, and they indicate a pathological state of the minister fire flaring upwards. Red points always indicate heat to a degree greater than when the tongue is just red. The intensity of their color and their distribution clearly correlate with the intensity of the heat. The more intense the color and the more dense the distribution, the stronger is the heat. Red spots look the same as red points, except that they are larger and they are usually seen only on the root of the tongue. Like red points, red spots also indicate heat, but with the additional component of some blood stasis. Red points are frequently seen on the tip, sides, center, or root of the tongue. Red points on the tip are relatively common and they indicate heart fire, usually deriving from emotional stress. Red points on the sides in the liver area indicate liver heat or liver fire, whereas red points in the center indicate stomach heat. However, stomach heat may also be reflected in red points on the sides, but only in the middle section of the tongue and along a broader strip. With lung heat, red points may appear either in the chest area or in the whole front third of the tongue, as opposed to the very tip, as in the case of heart heat. Red points on the root indicate heat, usually damp heat, in the bladder or intestines. The distribution of the red points also reflects the stages of penetration of an external pathogenic factor. In the very beginning stages of an invasion of external wind, the red points may be more concentrated on the front third or on the sides. In this context, these two areas correspond to the exterior of the body, while the center of the tongue corresponds to the interior. Thus, if after a few days the red points from these two areas extend towards the center of the tongue, it indicates that a pathogenic factor is penetrating into the interior. A purple tongue always indicates blood stasis, which itself may derive from cold or from heat. Internal cold contracts and obstructs the circulation of blood, leading to blood stasis. Heat leads to blood stasis by condensing the body fluids and blood. When blood stasis derives from cold, the tongue is bluish purple, while when it derives from heat, it is reddish purple. Therefore, the bluish purple tongue indicating cold derives from a pale tongue, while the reddish purple tongue derives from a red tongue. A tongue becomes purple only after a prolonged time, usually years. Therefore, it always indicates a chronic condition, and for this reason it is far more common in the elderly. The purple color of the tongue indicates potentially serious conditions, and in the presence of such tongue body color, we should always invigorate blood and eliminate stasis, as well as expelling internal cold in the case of blood stasis deriving from cold, and clearing heat in the case of blood stasis deriving from heat, even in the absence of any symptom of blood stasis. Serious conditions relating to blood stasis in Chinese medicine include cancer, coronary heart disease, stroke, and hypertension. The tongue can be only partially purple, and the most common areas are the sides, liver or chest area of the tongue, the center and the front third. The most frequent occurrence is on the sides in the liver area. Strangely, the tongue is never purple on the tip only, and blood stasis in the heart usually manifests in the chest or breast area instead. A purple color on the sides in the liver area indicates blood stasis in the liver, which may occur in any of the areas influenced by the liver channel. For example, liver blood stasis in the hypochondrium, epigastrium, lower abdomen, and uterus. It is interesting to note that although the uterus is in the lower burner, whose state is reflected in the back third of the tongue, Blood stasis in the uterus is manifested with a purple color not on the root of the tongue but on the sides in the liver area. A purple color on the sides in the chest area indicates blood stasis in the chest, which may include heart or lungs, or in women only, the breasts. In lung diseases, a purple color in the chest area is seen in chronic obstructive pulmonary disease such as chronic asthma, bronchitis, or emphysema. In heart diseases, a purple color in the chest area is seen in coronary heart disease. In addition, in women, a purple color in the chest or breast area may indicate a breast pathology such as breast lumps, whether benign or malignant. Observation of the breast area in women suffering from carcinoma of the breast is an important prognostic factor because if this area is clearly purple, the prognosis is poor, whereas if it is not, the prognosis is good. A purple color in the breast area is also sometimes seen in women without any breast pathology. This may indicate the predisposition to breast lumps, and one should therefore invigorate blood and eliminate stasis in the breasts even in the absence of symptoms and signs. A purple color in the center of the tongue indicates blood stasis in the stomach, whereas a purple color in the front third indicates blood stasis in the lungs. The sublingual veins should always form part of a routine examination of the tongue body. Under normal conditions, the two veins under the tongue are barely visible, and they have a very faint, pale red color. When they become clearly visible, they are by definition pathological. One should observe the size and the color of the sublingual veins. If the veins are distended but not dark, this indicates Qi deficiency. If they are too thin in relation to the sides of the tongue and the patient's body itself, this indicates Yin deficiency. The most important sign with regard to sublingual veins is their purple color. If they are distended and dark purple, this indicates blood stasis, usually in the upper burner, lungs or heart, but it may also refer to the liver. Distended and dark sublingual veins are more common in the elderly, and they give an early indication of blood stasis before the rest of the tongue body becomes purple. Observation of the sublingual veins, therefore, has an important preventative value. In modern China, some doctors consider the appearance of sublingual veins as a useful prodromal sign of certain diseases. We have reached the end of the topic, so we are expected to have understood the principle that the tongue spirit reflects the state of kidney essence and therefore the prognosis. The clinical significance of the three pathological colors, pale, red, purple, as overall body colors are applicable to specific areas. The importance of the observation of the sublingual veins. Tongue body shape. In this topic, we shall cover thin, swollen, partially swollen, stiff, flaccid, long, short, cracked, deviated, moving, quivering, and tooth-marked tongues. For example, a pale tongue may indicate yang deficiency, but if in addition to being pale, it is also very swollen, this indicates that the yang deficiency is severe and that it has led to the accumulation of dampness or phlegm. In this example, the tongue body shape reflects the full condition generated by dampness or phlegm. To give another example, if a tongue lacks coating, this indicates yin deficiency. But if in addition it is also very thin, it indicates that the yin deficiency is quite severe. In this example, the tongue body shape reflects the severity of a deficiency condition. To give yet another example, if the tip of the tongue is red, this indicates heart heat or heart fire, usually deriving from emotional problems. But if the tip is also swollen, it indicates that a condition of heart heat or heart fire is more severe. Thin refers to the thickness, not the width, of the tongue. The body of the tongue is formed by fluids and blood, and a thin tongue, therefore, always indicates a deficiency either of blood or of yin fluids. In the former case, it will also be pale, while in the latter case, it will be red. A thin tongue is actually not common, probably because dampness and phlegm, which make the tongue swollen, are such common and predominant pathogenic factors, as they tend to make the tongue swollen. Even if the patient has a concurrent severe blood deficiency, this would not manifest on the tongue body shape. The tongue on the slide is a good example of the coexistence of blood deficiency and dampness in women. In fact, it is pale and thin, which indicates blood deficiency, but it is swollen on the sides, which indicates spleen deficiency and dampness. The size of the tongue body has to be related to the size of the head of the person. What might be swollen for someone may be normal for another. As the thickness of the tongue body depends on the supply of fluids and blood, a swollen tongue body indicates an accumulation of fluids, which may be dampness, phlegm, or edema. Thus, a swelling of the tongue always indicates a full condition, and particularly one characterized by dampness or phlegm. Although dampness and phlegm usually arise from a qi or a yang deficiency, the swelling of the tongue body reflects the full condition created by these two pathogenic factors. While a total swelling of the tongue always indicates dampness or phlegm, a partial swelling may indicate other pathologies such as qi deficiency, qi stagnation, or heat. The areas where a partial swelling is most commonly seen are the sides in the liver or chest area, the tip, and the front third. A swelling on the sides in the liver area is very common, and it usually indicates liver heat. It is nearly always associated with a red color in the same area. A swelling on the sides in the chest or breast area generally indicates either retention of phlegm in the chest or breast or lung qi deficiency. A swelling on the tip of the tongue, usually associated with a red color, is very common, and it indicates heart heat or heart fire, deriving from severe emotional problems. A swelling of the front third of the tongue indicates retention of phlegm in the lungs. A stiff tongue lacks the normal suppleness and flexibility. It looks hard and stiff. It indicates internal wind, blood stasis, or severe yin deficiency. A flaccid tongue is flabby, and in severe cases, it has a crumpled look. It always indicates lack of body fluids or blood. A long tongue is rather narrow and, when extended, protrudes further than normal. Not commonly seen, it always indicates heat. A short tongue appears to be contracted, and the patient is unable to extend it out of the mouth cavity. The significance of the short tongue depends on the body color because it can indicate two opposite conditions. If it is pale, it indicates severe internal cold and yang deficiency, while if it is red and without coating, it indicates severe yin deficiency. In the first instance, the patient cannot extend the tongue enough because internal cold contracts the muscles, while in the latter instance, this happens because there are not enough fluids in the tongue. Generally, cracks on the surface of the tongue indicate yin deficiency or the tendency to it, but though this is the most common cause, there are others such as dampness or deficiency of the original qi. Horizontal cracks indicate yin deficiency, usually of the stomach or kidneys or both, and they are more commonly seen in the elderly. Irregular cracks usually indicate stomach yin deficiency or the tendency to it. A central short crack in the midline of the tongue is very common, and it indicates stomach yin deficiency or the tendency to it. A central long crack in the midline of the tongue is also common, and its clinical significance depends on its depth and on the color of the tongue body, especially the tip. If the heart crack is shallow and the body color normal, this simply indicates a constitutional tendency to heart patterns, and it does not have a specific clinical significance. However, if a person has such a crack, any emotional stress from which he or she might suffer will have deeper repercussions than for someone without a heart crack. A shallow heart crack on a normal body color may also indicate heart disease in the parents or even grandparents. If the heart crack is deep, it indicates that the person may suffer from a heart pattern due to emotional stress, all the more so if the tip is also red. Short, transverse cracks on the sides are a clear sign of spleen-heme deficiency. This is not common and is not a common condition often described among the spleen patterns. Such cracks are the easiest way of identifying such a pattern. Short, transverse cracks behind the tip in the lung area usually indicate a past lung pathology such as pneumonia, whooping cough, or repeated lung infections during childhood. As such cracks reflect past pathologies, they do not have a major clinical significance. An extremely deep midline crack with other small cracks branching out from it is usually seen in a red tongue without coating. It indicates a severe kidney-yin deficiency with empty heat in the kidneys and heart. The deviated tongue deviates to one side when extended. The most common clinical significance of a deviated tongue is internal wind, and this type of tongue is most commonly seen in the elderly. In a young person, it may be related to a heart deficiency. The moving tongue moves slowly from side to side with large amplitude movements when it is extended, and the patient cannot control its movement. It always indicates internal wind and is usually seen in the elderly. The quivering tongue trembles rapidly and with small amplitude movements as it is extended. The most common clinical significance of a quivering tongue in chronic conditions is spleen Qi or spleen Yang deficiency. The tongue with teeth marks indicates chronic spleen Qi deficiency. But since a tongue with a normal body shape can have teeth marks, do not assume that the presence of teeth marks necessarily means it is swollen. We have reached the end of the topic, so we were expected to have learned the ways observation of the tongue body shape supplement knowledge gained from observation of the tongue body color, the clinical significance of the various tongue presentations: thin, completely or partially swollen, stiff, flaccid, long, short, cracked, deviated, moving, quivery, and tooth-marked. Tongue coating. The tongue coating reflects the state of the yang organs and in particular the stomach. It reflects conditions of heat or cold and of fullness or deficiency. We shall take up physiology of the tongue coating, clinical significance of the tongue coating, presence or absence of a coating, coating with or without root, coating thickness, coating distribution, coating moisture, coating texture, and tongue coating in external diseases. The stomach rots and ripens food, and during the process of digestion, a small amount of turbidity or turbid fluids escapes upwards to reach the tongue. This forms a coating. Therefore, the presence of a coating indicates a normal functioning of stomach qi. A normal coating should be white and thin enough to see the body color through it. Although the tongue coating reflects primarily the physiological activity of the stomach, the spleen and the kidney also play a role in its formation. For this reason, if a tongue lacks a coating, this may indicate stomach-yin or kidney-yin deficiency or both. It should be noted that the tongue coating is naturally thicker at the root of the tongue and thinnest towards the tip, and that the coating does not extend to the very edges of the tongue. The tongue coating reflects primarily the state of the yang organs and especially of the stomach. It also reflects conditions of deficiency or excess and of heat or cold. Observation of the tongue coating needs to be based on a careful analysis of the history of the patient because the tongue coating changes very rapidly in acute conditions and can reflect short-term variations. For example, a yellow tongue coating in the center indicates stomach heat, and this could equally be a chronic condition of stomach heat or simply an acute stomach upset. We therefore need to inquire carefully to exclude the possibility that the yellow coating merely reflects an acute but passing condition. Apart from the history, the brightness of the coating can give us an indication of its duration. The duller the coating, the more chronic is the condition. As the coating reflects primarily the condition of the yang organs, its thickness and particularly its distribution give a clear indication of a pathology affecting one of the yang organs. For example, the sides of the tongue reflect the condition of the liver and gallbladder, and we can differentiate between these two by referring to the body color or coating. That is, if the body color is affected, it indicates a liver pathology, whereas if the coating is affected, it indicates a gallbladder pathology. Similarly, for the root of the tongue, if the root of the tongue is red without coating, this indicates kidney yin deficiency with empty heat, whereas if it has a thick coating, it indicates a pathology of one of the yang organs of the lower burner, bladder or intestines. The tongue coating also gives us a good indication of deficiency and excess conditions because a thick coating with root always reflects a full condition, while a coating without root or the complete absence of coating always reflects a deficiency condition. The tongue coating gives also a very clear indication of the hot or cold nature of a condition, but it may merely reflect a passing acute condition. The presence or absence of coating tells us primarily about the state of the stomach qi. If the tongue has a coating with root, it indicates that the stomach qi is still intact, even if the excessive thickness or color of the coating is pathological. Excluding the case of a normal thin white coating, the tongue with coating usually indicates a full condition precisely because the stomach qi is intact. A tongue without coating indicates that the stomach qi is severely weakened and therefore a deficiency condition. Therefore, it is better to have a thick pathological coating with root than not to have a coating. How does the coating disappear from the tongue surface? In chronic conditions, the tongue coating disappears gradually over a long time, usually years. In acute conditions, and especially acute febrile diseases in children, the coating may disappear very quickly in a matter of days. In chronic conditions characterized by the absence of coating, with treatment, the coating should return gradually and quite slowly. This is a positive sign. If the coating appears suddenly on a tongue that previously lacked it, this is a bad sign. For example, in a patient with cancer, the sudden return of coating to a particular area of the tongue may indicate a metastasis of the corresponding organ. Conversely, if a tongue has a very thick pathological coating, its sudden total or partial disappearance in the course of a disease is a poor prognostic sign because it indicates the sudden depletion of stomach qi. However, the clinical significance is different if a thick tongue coating becomes normal as a result of treatment. The tongue coating can change much more quickly than the tongue body color. We can compare the tongue coating to grass. It should grow out of the tongue body just as grass grows out of the soil, and it should have roots just as grass stems have roots in the earth. A coating with root reflects the normal functioning of stomach qi, even if the coating may be pathological. For example, too thick and dark yellow. A coating without root resembles mown grass scattered on barren ground. It looks as if it has been added on top of the tongue rather than growing out of it. In severe conditions, the rootless coating may look like salt or snow sprinkled on top of the tongue. A rootless coating indicates the beginning of the weakening of stomach qi in the course of a chronic disease. Therefore, it is better to have a thick pathological coating with root than to have a thin coating without root. It should be emphasized that the coating with root is not necessarily thin, although that is the most common situation. The coating without root can also be thick and often sticky. This represents the worst scenario because it indicates that on the one hand, stomach qi is weakened, and on the other, that there is a significant pathogenic factor against which the body is unable to fight due to the stomach qi deficiency. For this reason, it is obviously better to have a thin rather than a thick coating without root. Thin coating with root means healthy stomach qi. Thick coating with root means strong pathogenic factor, stomach qi still intact. Thin coating without root means beginning of weakening of the stomach qi. Thick coating without root, strong pathogenic factor, stomach qi weakened. The normal coating is thin and it should be possible to see the tongue body through it. If the tongue body cannot be seen, the tongue coating is too thick. The thickness of the tongue coating reflects the strength of the pathogenic factor clearly and accurately. The thicker the coating, the stronger the pathogenic factor. If a thin coating becomes thick, this indicates that the pathogenic factors are getting stronger or that they are penetrating deeper into the interior. The latter situation applies to conditions of acute external diseases. Therefore, if we are treating a patient with a thick tongue coating, we should expect it to become gradually thinner. In some cases, a thick tongue coating can revert back to normal even after a very short time. A thick coating may be with or without root, but the clinical significance of its thickness is the same. That is, it reflects the strength of a pathogenic factor. The same areas that reflect changes in the tongue body color also reflect changes in the tongue coating, but there are some differences. For example, the tongue coating never extends to the very tip or the very edges of the tongue. The most common locations where a thick coating is observed are in the center and on the root of the tongue. A thick coating in the center reflects the presence of a pathogenic factor in the stomach, which may be cold, heat, dampness, or phlegm, depending on the color and consistency of the coating, whereas a thick coating on the root reflects the presence of a pathogenic factor in the bladder or intestines. A pathogenic factor in the gallbladder may be manifested in a variety of ways. The most common one is a bilateral or unilateral coating that comes forward in one or two strips on the edges. The normal coating should be relatively moist, indicating a good supply and movement of body fluids. If the coating is too dry, it indicates either heat or yin deficiency. If the coating is too wet, it indicates severe yang deficiency. The normal coating texture should be like the hairs of a very fine brush, in Western medicine corresponding to the filiform papillae. The individual hairs, the filiform papillae, should be clearly seen and they should not be too dry or too wet. Pathological textures of the coating make it sticky, slippery, or moldy. The sticky or greasy coating has an oily but coarse appearance, and the individual papillae can still be seen. To visualize a sticky coating, one can use the analogy of a toothbrush of very fine natural hair spread with butter or lard. The toothbrush will appear very greasy, but the individual hairs can still be seen. Thus, although the sticky coating is greasy and oily, it may also be, in addition, dry. This may seem a contradiction, but it is not. To use the same analogy, we can think of a toothbrush with very fine hairs which has been spread with butter and left for several days. After that time, it will still have a greasy appearance, but it will be dry. Thus, we should not identify stickiness of the tongue coating with wetness. The sticky coating indicates either dampness or phlegm, and especially phlegm. The sticky coating is extremely common. The slippery coating has a greasy look. It is characterized by the fact that the individual papillae cannot be easily distinguished, as they seem to be covered by an oily fluid. To compare the slippery with the sticky coating, the former is oilier and the individual papillae cannot be distinguished, whereas the latter is coarser and the individual papillae can be distinguished. The slippery coating, like the sticky coating, also indicates dampness or phlegm, but predominantly dampness. The moldy coating looks thick, patchy, and crumbly. Chinese books describe it as tofu. To use a Western analogy, it could be described as cottage cheese. The moldy coating also looks greasy and is by definition without root. The moldy coating indicates also dampness or phlegm, but against the background of stomachache deficiency with empty heat. Empty heat plays a role in the formation of the phlegm, indicated by the moldy coating in evaporating the fluids. The moldy coating is seen only in the elderly. Coating texture. Sticky coating, dampness or phlegm, especially phlegm. Slippery coating, dampness or phlegm, especially dampness. Moldy coating, dampness or phlegm with stomachache deficiency. In external diseases from invasion of wind, the interpretation of the tongue coating is quite different from that of internal diseases. In external diseases, the thickness of the coating reflects not only the intensity of the pathogenic factor, but also its progression towards the interior. Thus, if in the course of an acute external disease, the coating becomes thicker, it indicates that not only has the pathogenic factor become stronger, but that it is beginning to penetrate into the interior. The coating in external diseases reflects hot and cold influences in the same way as in internal diseases, but there are differences. The most important difference is that the coating tends to be white in the very beginning stages of an invasion of wind, even if it is wind heat. If during an acute external disease, the coating turns from white to yellow, this means that there is not only a change from cold to heat, although a white coating may appear also in wind heat, but also a penetration of the pathogenic factor into the interior. The distribution of the coating also reflects the stages of penetration of an external pathogenic factor. In the very beginning stages of an invasion of external wind, the coating may be more concentrated on the front third or on the sides. In this context, these two areas correspond to the exterior of the body, while the center of the tongue corresponds to the interior. Thus, if after a few days the coating from these two areas extends towards the center of the tongue, it indicates that the pathogenic factor is penetrating into the interior. We have reached the end of the topic. on tongue coating, and we are expected to have understood that the coating primarily reflects the health of the stomach and spleen, but also may indicate a kidney yin deficiency. The coating also reflects conditions of deficiency or excess and heat or cold. Tongue observation should be supported by the pathology history, the aspects of the tongue coating that are clinically significant, specifically its presence or absence, the presence or absence of a root, the coating's thickness, distribution, moisture, and texture, and its interpretation in external disease. Tongue images and patterns. Topics include Qi deficiency, Yang deficiency, blood deficiency, Yin deficiency, phlegm and dampness, heat, cold, Qi stagnation and blood stasis, internal wind, and external invasions of wind. Qi deficiency. The tongue body color reflects primarily the condition of blood rather than Qi, and therefore, a mild deficiency of Qi may not manifest on the tongue at all. In long-standing cases of Qi deficiency, the tongue may become slightly pale. Severe spleen Qi deficiency may manifest with a swelling on the sides of the tongue in the central section. This swelling differs from a liver swelling in that it is much wider and it is more in the central section of the tongue, the middle burner. Stomach Qi deficiency manifests with a rootless coating or with lack of coating in the center, with the tongue body color still normal. In Yang deficiency, the tongue is definitely pale and it tends also to be slightly wet. In severe Yang deficiency, the tongue may also become swollen, but the swelling itself is due to the presence of dampness or phlegm rather than the Yang deficiency itself. A swollen tongue does not indicate Yang deficiency, but rather dampness or phlegm. When the tongue is pale, one cannot generally identify which is the main organ involved. For example, the tongue's paleness may be due to spleen Yang deficiency, kidney Yang deficiency, or both, and we cannot deduce from the tongue alone which is the case. The only guideline one can follow is that the more pale and swollen the tongue is, the more likely it is that the cause is kidney Yang deficiency. In blood deficiency, the tongue is also pale but tending to be slightly dry. In severe cases of blood deficiency, the tongue should be thin as well as pale, but this is seldom the case. Liver blood deficiency is frequently indicated by a pale color on the sides in the liver area. Although the tip corresponds to the heart, the tip is never pale on its own in heart blood deficiency. In this condition, however, the tongue may become pale in the chest area. The tongue coating is formed during the process of the stomach's digestion of food, and the normal tongue should have a thin white coating, which indicates a good state of stomach Qi. The normal coating is formed by the turbid fluids produced by the stomach's process of digestion and is therefore an expression of the normal state of stomach fluids and therefore Qi and Yin. If stomach Qi is weakened, the very first sign of this on the tongue will be a rootless coating in the center. If stomach Qi gets weaker, the coating will be rootless all over the tongue. And if stomach Qi deficiency progresses to stomach Yin deficiency, the tongue will lack a coating entirely. As the stomach is the origin of fluids, a tongue without coating always indicates a deficiency of stomach Yin. Of course, the tongue without coating is also seen in deficiency of yin of other organs, but whichever other organ is involved, it always indicates stomach yin deficiency. For example, the tongue may lack a coating in the front, indicating lung yin deficiency, but because the coating is a reflection of stomach qi and stomach yin, we can say that in this case there is a deficiency of yin of both the lungs and stomach. In terms of treatment, this means that whenever we see a tongue without coating, stomach yin should always be nourished, whatever other organ is involved. It is most important to stress that yin deficiency on the tongue is manifested by the lack of coating and not by the redness of the tongue body. Thus, if a tongue has a normal body color and lacks coating, we can say that it indicates yin deficiency, whereas if it is red and lacks a coating, it indicates yin deficiency with empty heat. Therefore, the lack of coating by itself indicates yin deficiency, whereas the lack of coating associated with the redness of the tongue body indicates yin deficiency with empty heat. Remember, yin deficiency is manifested by the lack of coating, not by the redness of the tongue. That is, lack of coating, yin deficiency. Lack of coating and redness, yin deficiency and empty heat. We can look upon stomach yin deficiency as the beginning of a yin deficiency that will eventually affect other organs. However, this does not mean that a yin deficiency is always indicated by stomach yin deficiency. For example, it is quite possible for someone to suffer from lung yin deficiency without stomach yin deficiency manifesting on the tongue coating. However, if the yin deficiency manifests with a lack of coating, we can say that there is some underlying stomach yin deficiency. We can identify several stages of yin deficiency according to the tongue coating and the body color. As far as the stomach is concerned, stomach qi deficiency usually precedes stomach yin deficiency, and the very first and lightest sign of stomach qi deficiency would be a rootless coating in the center. At the other end of the scale, the most severe type of yin deficiency, by this time with empty heat, would be a tongue that is red, completely without coating and possibly with cracks, indicating both stomach yin and kidney yin deficiency. We can therefore say that the tongue coating or the absence of it reflects a progression from qi deficiency to yin deficiency, usually starting with the stomach and gradually affecting other organs. The most common stages of this process that we can identify are as follows. Normal tongue with thin white coating with root indicates good stomach qi. Rootless coating in the center, normal body color, indicates the beginning of stomach qi deficiency. Rootless coating all over, normal body color, indicates stomach qi deficiency. Rootless coating all over but missing in the center, normal body color, indicates the beginning of stomach yin deficiency. A variation of this tongue would be that the center is red, which indicates stomach yin deficiency with empty heat, not affecting other organs. Coating missing all over, normal body color, indicates advanced stomach yin deficiency. A variation of this tongue would be that the center is red, which indicates advanced stomach yin deficiency with empty heat, not affecting other organs. Coating missing all over, red body color, indicates advanced yin deficiency with empty heat of the stomach and other organs, notably the kidneys. A variation of this tongue would be that, in addition to the above signs, the tongue also has a deep midline stomach crack and other scattered cracks, which simply indicate a more severe condition of yin deficiency of the stomach and kidneys. Any of the first five tongues indicated above could also have a central stomach crack or scattered stomach cracks, which would simply indicate a pre-existing tendency to stomach yin deficiency. Both phlegm and dampness may manifest with a swollen tongue and a sticky coating. However, in the case of phlegm, the swelling of the tongue is predominant, whereas in the case of dampness, the coating is predominant. Although both phlegm and dampness may derive from qi deficiency on its own does not cause the tongue to be swollen. Therefore, a swollen tongue indicates not qi deficiency, but rather the presence of a pathogenic factor, that is, phlegm or dampness. The tongue coating will differ slightly depending on whether there is dampness or phlegm present. Dampness causes the coating to appear more slippery and smooth, whereas a coating indicating phlegm tends to be slightly rough and sticky. Heat always manifests with a red body color, and when examining a red tongue, the first question we ask is whether the tongue has a coating or not. A red tongue with a coating with root, whatever its color, indicates full heat, whereas a red tongue without coating or with a rootless coating indicates empty heat. Full heat, red tongue with coating; empty heat, red tongue without coating. When observing a red tongue indicating heat, we should identify the level of the heat in accordance with the identification of patterns according to the four levels. Although the theory of the four levels was developed to explain the symptoms and signs of acute febrile diseases, it can be applied to conditions of chronic heat. Indeed, much of the knowledge regarding red tongues and red points derives from the theory of the four levels. At the defensive qi level, the tongue may be red or slightly red on the front or sides, or both, in the areas corresponding to the exterior in the context of invasions of external wind. At the qi level, the tongue is red with a yellow, dark yellow, brown, or even black coating. However, within the qi level, one can distinguish the two conditions of heat or fire. Heat is more superficial than fire and can be cleared with pungent cold herbs. Fire is deeper than heat and needs to be drained with bitter cold herbs. Within the theory of the 6 stages, the bright yang channel pattern corresponds to heat of the stomach, and the bright yang organ pattern corresponds to fire. Within the theory of the 4 levels, the pattern of stomach heat corresponds to heat, whereas that of dry heat in the stomach and intestines corresponds to fire. The tongue corresponding to heat is red with a yellow coating, whereas that corresponding to fire is darker red and with a dry, dark yellow, brown, or even black coating. At the nutritive qi and blood levels, the tongue is red and dry without a coating because at these levels, the fire has injured yin. Cold affecting a yin organ will manifest primarily on the tongue body color, which becomes pale. For example, spleen yang deficiency commonly manifests with a pale tongue. Cold affecting a yang organ will manifest primarily on the tongue coating. For example, cold in the stomach manifests with a white coating in the center. When assessing the tongue in cold patterns, we must distinguish full from empty cold. Full cold manifests primarily on the coating, which becomes thick and white, while empty cold manifests primarily on the color and moisture of the tongue body, which becomes pale and slightly wet. The tongue body color reflects the condition of blood more than that of qi. Therefore, in conditions of qi stagnation, the tongue body color may be unchanged, whereas in blood stasis, the tongue body color will become purple. A purple color on the sides always indicates blood stasis. In severe and long-standing conditions of liver qi stagnation, the sides in the liver area may become red. However, in this case too, we can say that the tongue body color may reflect the condition of blood primarily because the redness of the sides of the tongue indicates that long-standing qi stagnation has given rise to heat. Thus, the redness on the sides reflects the heat rather than the qi stagnation. Blood stasis may manifest also with the purple and dark color of the sublingual veins. This normally reflects the early stages of blood stasis, particularly when it occurs in the middle and upper burners. In internal wind, the tongue may be stiff, moving, or deviated. Stiff is the most common way in which internal wind manifests. The moving tongue is not frequently seen, while the deviated tongue indicating internal wind is usually seen only in patients suffering from wind stroke. As far as the body color is concerned, in external invasions of wind cold, the tongue body color does not change. In invasions of wind heat, the tongue body color may become red in the front or sides or both, and especially in children, it may also have red points in these areas. As far as the coating is concerned, this reflects invasions of external wind only when the pathogenic factor is particularly strong, in which case the coating becomes thick. In the very beginning stages of invasion of wind, the coating is white even with wind heat. In other words, in the context of external invasions of wind, a white color of the coating indicates the early stage of invasion, whereas a yellow color indicates a later stage. The body color indicates the conditions of blood, nutritive qi, and yin organs. It reflects conditions of heat or cold and yin or yang. The body shape indicates the state of blood and nutritive qi. It reflects conditions of fullness or deficiency. The coating indicates the state of the yang organs. It reflects conditions of heat or cold and of fullness or deficiency. The moisture indicates the state of the body fluids. A pale body color indicates either deficiency of yang or deficiency of blood. In deficiency of yang, the tongue is also usually slightly too wet, since deficient yang qi fails to transform and transport fluids. In deficiency of blood, the tongue tends to be somewhat dry. If the sides of the tongue are especially pale, or in severe cases, slightly orangey, it indicates deficiency of liver blood. By red is meant too red. A red tongue body always indicates heat. If the tongue has a coating, it indicates full heat. If there is no coating, it indicates empty heat. A red tip, usually on a red tongue, indicates heart fire or heart empty heat, according to whether the tongue has a coating or not. In severe cases, the tip can also be swollen and have red points on it. Red sides indicate liver fire or gallbladder heat if there is a coating, or empty heat in the liver if there is no coating. In severe cases, they may also be swollen and display red points. A red center indicates heat or empty heat of the stomach, depending on whether there is a coating or not. Red tongues are likely to have red points or spots. These are raised papillae and always indicate heat. If they are rather large, called spots rather than points. In addition to heat, they also indicate stasis of blood. Red points or spots are frequently seen on the tip, heart fire, on the sides, liver fire, on the root, heat in the lower burner, and around the center, stomach heat. A purple tongue always indicates stasis of blood. There are two types of purple color, reddish purple and bluish purple. A reddish purple tongue indicates heat and stasis of blood, and it develops from a red tongue. A bluish purple tongue indicates cold and stasis of blood, and it develops from a pale tongue. A purple color is frequently seen on the sides, indicating liver blood stasis, or in the center, indicating stasis of blood in the stomach. A purple color on the sides may also reflect blood stasis in women, and in such cases, it is usually bluish purple. The tongue body color reflects blood more than qi, and qi stagnation often may not manifest on the tongue at all. If the tongue is purple, it always reflects blood stasis. The body shape of the tongue gives an indication of blood and nutritive qi, and it reflects the full or empty character of a condition. A thin body indicates either blood deficiency if it is pale, or yin deficiency if it is red and without coating. In both cases, it indicates that the condition is chronic. A swollen tongue generally indicates retention of dampness or phlegm, especially phlegm. A partial swelling usually indicates heat. A swollen red tip indicates severe heart fire, while swollen and red sides indicate liver fire. Swollen sides that are wider, usually on a pale tongue, reflect spleen deficiency. A swelling in the front third of the tongue indicates phlegm in the lungs. A stiff tongue usually indicates interior wind or blood stasis. A flaccid tongue indicates deficiency of body fluids. A long tongue indicates tendency to heat, and in particular, heart heat. A short tongue indicates interior cold if it is pale and wet, or extreme deficiency of yin if it is red and peeled. Cracks indicate either full heat or deficiency of yin. Short horizontal or vertical cracks indicate stomach yin deficiency. A long, deep midline crack reaching the tip indicates a tendency to a heart pattern. We call this a heart crack. A shallow, wide crack in the midline, not reaching the tip, indicates stomach yin deficiency. We call this a stomach crack. Short, transverse cracks on the sides in the middle section of the tongue indicate chronic spleen qi or spleen yin deficiency. A quivering tongue usually indicates spleen qi deficiency. A deviated tongue indicates interior wind. A tongue with teeth marks indicates spleen qi deficiency. The tongue coating reflects the state of the yang organs, and in particular the stomach. It reflects conditions of heat or cold and of fullness or deficiency. A normal tongue should have a thin white coating. The tongue coating is formed from some residual dirty dampness which is left over from the stomach's digestion and reaches the tongue upwards. Thus, a thin white coating indicates that the stomach is digesting food properly. The coating gives an indication of the presence or absence of a pathogenic factor and of its strength. A thick coating always indicates the presence of a pathogenic factor, and the thicker the coating, the stronger the pathogenic factor. Such a pathogenic factor may be exterior or interior, such as exterior wind, dampness, interior or exterior, cold, retention of food, phlegm, heat, fire. A coating without root looks as if the coating had been added to the tongue rather than growing out of it. This indicates deficiency of stomach qi. The partial absence of coating indicates deficiency of stomach yin. The total absence of coating indicates deficiency of stomach yin and or kidney yin. If the tongue is also red all over, it is a definite indication of deficient kidney yin with empty heat. The pathological coating colors can be white, yellow, gray, or black. A white coating indicates a cold pattern, unless of course it is thin and white, in which case it is normal. A gray and black coating can indicate either extreme cold or extreme heat, according to whether the tongue is wet or dry. The amount of moisture on the tongue gives an indication of the state of body fluids. Whenever the tongue is red or deep red, one should check the moisture. If the tongue is also dry, it means that the heat has begun to injure the body fluids. A normal tongue should be very slightly moist, indicating that the body fluids are intact and are being properly transformed and transported. If the tongue is too wet, it indicates that yang qi is not transforming and transporting fluids, and these accumulate to form dampness. If it is dry, it may indicate either full heat or empty heat, according to whether the tongue is a coating or not. If the coating is sticky or slippery, it indicates retention of dampness or phlegm. We are now done with our last topic, and it is expected that we should have learned the appearance of the tongue with a deficiency of qi, yang, blood, and yin, the appearance of the tongue in phlegm and dampness, with heat, cold, qi stagnation and blood stasis, and with internal and external wind. Thank you very much for listening.